I'm putting the word wrong in quotation marks as we discuss the types of things that could go wrong in development, and that's because some people would be offended by the word wrong here, as if a child is in any way flawed or that there's something wrong with them given their developmental path, and I understand that. Here I want to describe 3 types of paths in development, and the emphasis will be on how both nature and nurture, genetic inheritance, and environment play a role together in development. We're going to be talking about PKU, known as phenylketonuria. We're going to be talking about Down syndrome, for example, trisomy 21, and we'll talk briefly about fetal alcohol syndrome as well. All right, let's talk about phenylketonuria, PKU. PKU is a genetically inherited trait. It's dominant, meaning that most children in a family will inherit this characteristic. Phenylketonuria involves an inability to metabolize the amino acid phenylalanine, and this is a substance that's found in milk and meat products. What happens is that the child's unable to break down or metabolize these substances, and so they build up in the bloodstream and crowd out other nutrients. And the result can be fairly serious. Here you're looking at a little boy on the left who inherited phenylketonuria, and it went untreated. This child has some medical problems, structural problems, and cognitive deficits. On the right, you see a little girl who also inherited PKU. I believe this is his sister, but it was detected in time and treated. So how would you go about treating phenylketonuria? In most hospitals today, a child is tested at birth for phenylketonuria so that the treatment can begin immediately. Think about it. What would be the treatment for a disorder of this type? Dietary restrictions. One would restrict the foods that you give the child that contain the amino acid phenylalanine. Restrict the child from eating milk or meat products. With this type of treatment, a child can grow up without the medical and structural abnormalities, and the child can have full cognitive abilities. With treatment, standardized intelligence scores are comparable to those of other children. So this is an example of a disorder that is genetically inherited, strong genetic component there, but it's also impacted by environment. The dietary restrictions are an environmental intervention. And again, it's not just nature or nurture, it's always both. I said that we would also talk about Down syndrome, for example, trisomy 21. We know that Down syndrome is caused by maternal aging, meaning that in the development of the eggs there are differences in how the genetic material is divided up. And so we have a child who has extra genetic material. I also said that we were going to show you pictures of chromosomes from individuals, and here you're seeing one of those pictures. This is called a karyotype, K-A-R-Y-O-T-Y-P-E, and it's obtained by taking a tissue sample, usually by scraping the inside of the mouth, and then placing that tissue on a microscope slide, moistening it and looking at it under a microscope. In the old days before computers, a scientist would have to take a photograph of a magnified view of those chromosomes and then cut up the photograph to put the chromosomes in order according to an international standard, resulting in a karyotype. Obviously, things have become much easier with computers. But here you have a picture of the chromosomes from the cell of an individual with Down syndrome. And these chromosomes have been placed in order according to an international standard, and you can see that there is an extra 21st chromosome. And any deviation from the normal amount of chromosome can result in structural or cognitive deficits or medical problems. You can also see photographs of children who've been diagnosed with Down syndrome, and you can see some of the characteristic facial features of children who are diagnosed in this fashion. Thinking about the causes of Down syndrome in the context of the nature-nurture controversy. Here you have maternal aging influencing genetic inheritance, or environment influencing genetics. Let's talk about fetal alcohol syndrome. This is a syndrome that occurs when a woman drinks large amounts of alcohol while pregnant. and there are effects on the child who's developing in utero. There can be serious medical problems, structural deficits, cognitive deficits, and certain types of characteristic facial features. I often get a question from students about how much alcohol is too much, and the American Medical Association does not specify a specific amount of alcohol. I imagine because it varies from person to person. However, it is very good advice to ask women who are pregnant not to drink alcohol in order to protect her child from symptoms of fetal alcohol syndrome. So let's think about this situation. You have an environmental influence, ingestion of alcohol during a pregnancy. However, environmental factors also play a role. It may be that this particular child has genetically inherited a tendency to be more resilient in the context of exposure to alcohol in utero, or it may be that the child has inherited a tendency to be more vulnerable to these effects. It's never just nature or nurture.